Hello, Chapa-De patients. It's Dzurella, nurse practitioner here. Just sending you a quick message on the COVID-19 vaccine. We are making progress and vaccinating a lot of people and trying to get out of this pandemic that we're in. We've reached a spot where the people that definitely wanted it and were eager to get it have gotten it. And there's been actually over 100 million people in the country that have gotten at least one dose. We're at a point now where we're seeing a lot of folks that are hesitant or are wanting to wait a little bit to get their vaccine, which is completely understandable. And so there's, a lot of evidence that shows that so far these things are safe and definitely effective at protecting against getting the virus. And if you do happen to get it, that the outcomes are much better. For example, people are not hospitalized hardly at all, and the death rate has been cut almost to zero. And so, all of the medical providers here at Chapa-De have been vaccinated, and we all looked really closely when it first came out. The first few days I was pretty hesitant to trust it since it didn't come out so quickly. And so I think that's a common thing that a lot of people are going through. And for me, I do know how to look at evidence and look stuff up and get reputable sources for my information. And so I was able to do that, and within a few days of thinking about it, talking to my family about it, I decided to go ahead and get vaccinated. And so I was pretty convinced that the vaccines are safe and effective. In the trials, they saw that none of the people that were vaccinated were hospitalized or died from COVID. So that gave me the confidence to get the vaccine as soon as it was available to me. Your health and the community that we're in, health is really important to me, and getting this vaccine will protect you and your loved ones from getting sick. It'll also help us getting back to the things we love and getting back to normal, and traveling and seeing all of our family and friends and being able to do that the way that we used to. Indoors or outdoors, right? And so, I do encourage all my patients to if you have questions, to talk to me. You can send me a web message or even make an appointment if you have a lot of questions, and I'm more than happy to answer those for you. Some of the common things that are brought up to me for people that aren't sure about the vaccine are, is it effective against all these variants we're seeing? And so far it looks like it is. And it's sort of a race against the clock to get as many people vaccinated before this thing mutates even further. And so far it looks like, it is effective against the variants that we're seeing pop up. Another big one is that the vaccine was rushed, and really the time it takes to develop a vaccine is a long one, and a lot of it is what they call red tape, or getting the approval to research vaccines and getting the approval for funding. And that can take years, and actually most of the time it takes to get a vaccine to the point where it's ready for people's arms is that kind of red tape. And so with the COVID vaccine, a lot of research was done even before COVID came around as far as the mRNA vaccines that they use. Have been studied for a long time, and really the process of making sure the vaccine is safe was about the same time it takes for normal vaccines. So that's one I like to just educate people about a little bit, and make sure that that it is safe. And long-term effects of the vaccine is another one, and so far we don't have any reason to think there are going to be any long-term side effects of the vaccine. With COVID, though, there have been shown to be long-term side effects. About a third of people will get sometimes mild, loss of smell, and sometimes not so mild. The breathing problems that last for months and maybe even years. So we know that that's happening as a long-term effect of being infected. So again, it's a strange time we're in, and I just want to make sure all my patients are educated and making a good decision with good evidence. And if you have any questions, I'm more than happy to answer those, and please let me know if you do, and hopefully we can get through this together and get back to normal. Thanks for listening.